Even though the healthcare tax credits ABC's Jay O'Brien mentioned just a few minutes ago won't expire until the end of the year, open enrollment for healthcare plans on the marketplace is open now. And looking ahead, if those tax credits aren't extended, it could mean quite a hefty price increase for the average American. Midday's executive producer spoke to Dr. Katherine Hempstead, Senior Policy Officer at the Robert Wood Johnson Foundation, to find out what we need to know about the cost of health care as a result of the government shutdown deal and what it could mean for your family's finances in 2026.
The big change, and it's not a good change, but the big change is that as of now, it appears that the enhanced premium tax credits, which were kind of a second layer of tax credits that have been additive to the original tax credits over the last few years, that those tax credits are going to expire at the end of the year. So that means the premiums people are going to be asked to pay for plans that they will be choosing now that will start in 2026 are going to be higher because they're going to reflect the fact that their tax credit is going to be smaller.
Talk to me a little bit about the costs before this tax credit expired. Like when I think of private insurance, I think of, the premiums, and they're more expensive for a PPO versus for an HSA account. What does it kind of look like before, like if these credits were to stay on, what would it still look like for an overall kind of cost increase for most American families?
This is true, but it kind of varies for everyone. That sort of the average increase is supposed to be in the range of like 115%. So that's kind of a doubling, So for some people on the low end of the income distribution, and the premiums, the tax credits are means adjusted, in the ACA, so that people with lower incomes get bigger tax credits and are asked to pay a smaller percent of their income for coverage, than people at the high end of the income distribution. So for people at the lower end of the distribution, they may be going from having a plan where they had a premium of actually zero, which in some cases was the case. These are very low income people, to maybe being asked to pay $65, $75, $85, which is a big change in terms of percent. Obviously it's a huge multiplication in order of magnitude. It may not seem like a huge change, to you or me, it might say $65, $75, but if you're a very low income person, it's a huge change. And, we unfortunately think a lot of people in that age range are going to drop coverage. There's also, I think, so I'm sort of talking to you about where things are like extra bad. So that's one place. And then at the higher end of the income distribution, that people before the enhanced premium tax credits, people over 400% of the federal poverty level didn't get any tax credit at all. And we referred to that as the quote unquote subsidy cliff. Like you just would sort of fall off the cliff and then just be facing, the retail cost of coverage. And if you're older, that's a lot because the premiums go up with age. So one of the things that people thought was really important about the enhanced premium tax credits is they ended that subsidy cliff, and they had a sort of a gradual fade out of tax credits as your income got higher, so that it was capped at a percent of your income rather than, a drop off at a certain relationship to the poverty level. So people at the higher end of the income distribution, especially older people, and, in a rural state like Utah, this is something that we know really affects like farmers and ranchers and like self-employed people who really need the coverage. Their income's not super low. They really benefited from those enhanced premium tax credits. They're going to go back to a world where they're being asked to pay full freight, the whole cost of coverage. And for, in some cases, it's actually going to be like pretty expensive. So that's a kind of, another bad case of sticker shock for people. And then in the middle, people are looking at maybe a $50, $75, $100, $150 increase in their premium, kind of depending on what zip code they live in, what their, what kind of plan they're in. It's hard to, it's kind of a general case, but I'd say like it's worth knowing about the impact on the two ends of the income distribution. That's probably the most sort of gripping. And then in the middle, it's kind of in between.
Right. So as people are looking to redo their enrollments and whatnot, what are some of the things they need to be looking at with these plans so that they don't experience this huge sticker shock?
Well, okay, great question. The first thing I want to double down on for people is that the coverage itself is not changing. The coverage itself is the same. And I think, it was unfortunate during all the sort of political back and forth about this. Some politicians took to the airwaves and said things like, this is terrible coverage and stuff like that. It's not true. This is coverage that's very, very much like employer coverage. It's comprehensive. It covers all the medical services that people need. It covers drugs. It's not terrible coverage. And the coverage is not changing. Like the standards, the requirements, that's all the same. So I wouldn't want people to draw the conclusion that the individual market is no longer a useful place for coverage. It is, but it's just become more expensive. So I think, to get to your question, some people are going to consider whether they should drop down to a lower actuarial value plan to save money. So, in the individual market, there's different metal levels: bronze, silver, gold, platinum, and they correspond with different trade-offs basically between premiums and cost sharing. That, they're all the same in terms of what they cover, and there's no like free lunch or bargain or secret. It's just you're going to pay a lot every month and have a low deductible, or you're going to pay less every month and have a really high deductible. So most people pick silver. Like 67% of people pick silver. Some people pick bronze, and they tend to be either people that hardly have any money and that's all they can afford, or they really feel comfortable that they could handle a $3,000 bill, and so they'll take that risk. So it's kind of the different people can find that's the right plan for them. And then not that many people, but some people choose gold, and those are people that sort of know they're going to use care a lot. They don't want a lot of volatility, so they pay higher premium, and they have lower cost sharing and a lower deductible. So that's kind of the landscape. So when premiums go up, some people may say, oh, I'm going to drop down to bronze. I'm going to choose a bronze plan instead, because that's going to be more manageable for me, with my monthly, the monthly bills I have. And that can be the right decision for people. Of course, what they'll notice is that when they do go seek care, they're going to have to spend more money out of their own pocket, and they're going to have a higher deductible. But I want to point out that even in a bronze plan, all of your basic preventive services are available to you with no out-of-pocket costs. So if you get your vaccinations, you get cancer screenings, you get a mammogram, all those kinds of things, those are covered at no cost to you. So you can still get those visits even if you have a bronze plan. So, it's sometimes I feel like people could sort of fall into a mindset where they say, well, that coverage is worthless because I have so much out-of-pocket expenditure. But it's really not. If you end up in the emergency room, you'll be sorry because you'll have a big bill. But you do get all the preventive care with no cost sharing, and your exposure is limited to your maximum out-of-pocket, which is it's about $11,000. It's a lot, but I think everybody knows it could be a lot worse if you didn't have coverage and you ended up in some situation where you had a huge number of bills. It could greatly exceed that very fast. So I do think that it's better than nothing, and for some people it will be the right choice. One thing I want to say, and this is a little bit in the weeds, but if your income is below 250% of the federal poverty limit, you are eligible for a benefit that's called cost sharing reduction, which is exactly what it sounds like. It means that you will pay less for copays, you will pay less for coinsurance. So you only can get that benefit if you're in a silver plan. So if you're a low income person and you're feeling like, oh, I'm going to drop down to bronze, it does come with a pretty big trade-off because you're going to lose that cost sharing reduction. So if you can find a way to stay in silver, it's, I think, there's a lot of benefits to staying in silver. So those are some things about, thinking about what plan to be in. I mean, there's no magic trick that makes this problem go away. I think that, the thing to think about is, would it make sense to drop to a lower actuarial value plan?
Awesome. And I know we're almost out of time, but I do want to ask just real quickly.
Sure.
On the affordable, the tax credits as they expire, we've talked about the impact they'd have on families, but can you talk just for a second on the impact they'll have on the healthcare system as a whole?
Yes, absolutely. That's a great question. And this is sort of the way that, uninsurance is not something that only affects the person that loses their insurance. It kind of ripples out. So when people lose their coverage, they stop going in for care. So doctors and hospitals lose that revenue when people go in for checkups and just minor problem visits, or the things that you would do if you had insurance. And so they lose that revenue, and that places, a lot of pressure on the system. And then what happens a lot of times is people delay care until they're really sick, and they might come and seek care in a very costly setting like the emergency room. And then they'll generate a large bill that they won't be able to pay, and they'll ask for charity care. And so that's, those two things, kind of the lack of paying customer and the increase in non-paying customers, both of those things are financially very, very bad for the healthcare system, and I think especially in areas where, like rural areas where the system is more fragile and there's, fewer sources of steady revenue, this revenue will be missed, and it can be, very consequential for the healthcare system, especially when we know that there are some big changes to the Medicaid program coming as well. So the two things together, it puts a lot of pressure on the healthcare system for sure.
Open enrollment for the health care coverage under the Affordable Care Act opened on November 1st. It runs through December 15th if you want the coverage to begin on January 1st. If you want to delay a bit, the final day to enroll for coverage in 2026 is January 15th. In that case, coverage will begin on February 1st. You can review plans and get all the information at healthcare.gov.